We're at the Lincoln Medical Center here, and we're in the middle of a pandemic in April of 2020. And Britt, we are here with our CEO, General Manager Britt Dye. And Britt, today we're here to honor our healthcare workers.
Yes, we are, Don. We thought that would be something good to show our support. You know, they're on the front line and doing all this testing, as well as the health department and those kinds of places. And we just want to show how much we support, and we're out here, you know, and they're all appreciating it very much. And our folks are really glad to be able to do something like this.
That's true. We're getting them biscuits, and we're also going to go to some other places later on. But we really appreciate what they're doing because they're dealing with it firsthand every day.
Every day, and you know, like I said, they're on the front line, and we've been very blessed by not having a lot of cases here in Lincoln County. And you know, the care that they give everybody and provide, you got to give them a lot of credit to be out there on the front line doing what they're doing for us.
We're living in a completely a new normal, and I'm sure we'll see that even in our office. We are working to try to take care of each other, and that's what we're doing here. We're taking care of our other part of our community.
Absolutely, and you know, we're really proud to be able to do this, and you know, working with Russ Spray on getting the hospital to recognize that, and we just can't say enough thanks to the front care workers.
We got a lot of our employees are volunteering to be out here. It started at 5 o'clock this morning, and we've got our flag in the background, and we're doing everything we can to let these folks know that we appreciate what they're doing, because you never know, any of us could need them any minute.
That's correct, Don. You know, we got the nursing home that will be coming up next week sometime, or the Patrick and the health clinic out there, and just always want to do what we can for the community, but we also want to show the frontline workers how much we support and really thank them for what all they've done.
Yep, and we do. We appreciate them, and we appreciate all of our staff, our volunteers, to come out to do this morning on their own time, and we appreciate what you've done to organize this big orchestration to get everything here, especially 2.5 hours before work time.
Well, we got a lot of good help. You know, our employees go above and beyond, and they've always have come up with good ideas to do things, and you know, we try to get all the employees involved, and you know, it's really great to have such a good group like what we got.
Absolutely. Well, thank you very much, and thank you to the healthcare workers and for all the folks who are out there working, trying to keep us safe. And we hope and pray our community continues to stay safe, and let's get this thing behind us, Britt.
Yeah, get it behind us so we can try to get back to normal at some point in time.
Absolutely. Thank you very much.
Thank you.
We are here with the CEO of the hospital, Mr. Russ Spray, and you're a CEO for just a little bit longer because you got things are changing.
Things are changing. You know, I came in back in, gosh, I guess it was end of August as the interim CEO, and thought I'd be here about 6 months, and honestly, we've been 6 months have flown by, and it's looking more like 10. End of May, I'll be out of here. We have a CEO, the board recently selected, Mr. Darrell Blaylock. Darrell will be joining us June 1, coming to us from West Tennessee, Martin, where he and his wife Tina live. They've been there 7 years, and Darrell's a good guy, and I was telling someone he's just a normal guy, and there's a lot to be said for normal.
That's right.
And as he interviewed, that's exactly the way he came across. As we went back and checked references, that's exactly what people said. So his references read just like his interview played out. But that's so important for our health system that we get the right person. The board, they put a lot of effort into this and worked through a lot of applicants. I won't even tell you how many, but it was many, several. Yep. I'll say that. But we really had to get it right, make the right decision, and we feel strongly that we've got the right person coming on board. A lot of work. We have great people at the health system. There's great people everywhere. We know that.
Yeah.
But when you just think about Lincoln County, what's going on here today with FPU, just coming out and supporting healthcare workers. I mean, no one asked for that. No one expected that. but you guys stepped up, offered it, and it's so appreciated. And healthcare workers are very much like utility workers. To do it and do it well and to stay after it, you really have to have a servant's heart, serving others, and that really speaks volumes about people who choose healthcare, who choose public service, and it says a lot about Lincoln County as well. So we're just proud of the health system. Fortunately, we've been spared a lot of the anxiety, well, maybe not the anxiety, but certainly all the health issues that go with those areas that have been hit hard with COVID.
Sure.
Lincoln County, I think we've had 10 cases to date.
Right.
We've had 3 patients in our hospital, but every patient, every visitor that presents is the next potential COVID, and that's exactly how we've had to approach things.
Yep.
And our employees, we've about 400 workers in the health system.
Wow.
They've stepped up, and they just get it done day in and day out. And so we're truly blessed to have such good people that work with us, who stayed with us. Just earlier, someone came through, and I think you were commenting on Billy Joe Brumbelow, and Billy Joe's been here 40 years.
Wow.
And I think I made the comment, if we had to give him a biscuit for every year that he's here, we'd probably run out of biscuits.
That's right. That's right. Oh, Billy Joe, been around a long time, and a lot of folks watching will probably know him for sure. And plus all the other folks, you are a homegrown boy who graduated Central. Did you ever dream that you would see days like today?
No, if anyone tells you yes, they could imagine that, then I don't know about that. But no one could ever have imagined this, and in any part of the country, for sure. And there's not a sector of our economy, there's not a community that has not been adversely impacted by COVID-19. We certainly hope that we have the worst of it behind us.
Let's hope so.
We truly have seen a mobilization of the country, companies producing ventilators, PPE, whatever it may be, things that, an automotive plant producing a ventilator. Now, who would have ever thought that?
That's right. But
then also companies busy now producing, looking for the right vaccine, for the right medications for it, the right test to diagnose COVID-19. When we started, we were testing. Results may have taken 3 to 5 days. Then as the demand amped up, we started looking at 7 to 10 days for turnaround on test results. Now we're down to 24 to 48 hours because more testing capabilities come online, and that's just, again, speaks volumes about our nation and the people that we are. So
I guess when you first started hearing about COVID-19, I'm sure y'all had to have a lot of meetings to decide what you're going to do and where you're going to ramp up and how you were going to do things.
Well, thank goodness for really good people that know what they're doing. In our case, our infection preventionist, Courtney Sanders, she was on top of it. She was in close communication, as was every other facility out there, in close communication with CDC, EMA, TEMA, FEMA, and so lots of coordination of efforts there. And it's really just making sure that we follow the playbook, do what's expected, what's the right thing to do, but also at the same time making sure that we take measured steps as opposed to jumping from A to Z. Let's make sure that we're ready for Z, but let's do what we need to at the moment. And again, as things began to pick up, we began to mobilize more and more resources.
And now we want to try to get on through this. We may be over the hump, but we still have a ways to go.
No doubt about it. And I think that's the greatest fear of both federal and state and local officials, is that we let the guard down thinking COVID's behind us when really it's not. And it's so foreign to us. That's the other thing about it. The idea of social distancing, no handshakes, that's just not who we are. And so I still find myself extending a hand but pulling it back. And so it's just going to take a concerted effort there to make sure we do the right things.
Well, we thank you. We thank all your staff, and we hope that we can continue doing what we're doing. And hopefully today FPU is just in some way just saying thank you, because you never know, we all might need you any minute.
Yeah. That's the thing about it. We so appreciate all the efforts here in FPU. And when Britt called, I was, again, that was not expected, but he certainly wanted to make that offer of respect and appreciation for healthcare workers. So we so do appreciate all that y'all do.
Good luck on your retirement, and we wish you well, and we wish you safe here as you wrapping up. And again, thank you very much.
Thanks, John. I have a feeling I'll be seeing you around.
That's right.
I'm a native Lincoln County, and I'm not going anywhere.
That's right. All right.
Thank you.
We've had Russ Spray, our CEO, and here at the hospital, at the Lincoln Medical Center. We appreciate him, and we appreciate all the staff here. And thank you again.
Thank you.